Okay, are we ready to get going again? Yep. Okay, so let me just remind you where we were. We were talking about the idea of boundaries around the inclusion of stakeholders and issues, and the fact that value judgments direct the drawing of boundaries. And I talk about values very deliberately because it's more than purposes. Some people talk about purposes. But there's more associated with this. If your purpose, let's say, is to preserve a native fish in a river, then you're going to have a whole set of values around biodiversity and those sorts of things. So it's a broader concept than just purposes. Now, in terms of making this practical, I mentioned the ideal of everybody involved and affected having a say in setting boundaries. And Werner Ulrich developed a tool to help make this practical. And his tool is a set of 12 questions. The set of 12 questions can be asked in about what the situation is now, and it can be asked about what the situation ought to be, so that you can contrast what you've got now and what you think it ought to be. The 12 questions cover 4 areas. I could have given you the questions themselves, but it's too much detail, really. The questions cover 4 areas. One is motivation. So why would people want to be doing what they're doing? Why do people think it ought to be like this? Issues of control. Who should have decision-making authority in this situation? Who should not? What should decision makers be able to have control over? What should they not be able to have control over? Those sorts of questions. Decisions about expertise. What counts as expertise in this context? What sorts of expertise matter and do you have to take account of? And questions about legitimacy. So those cover a range of things from the basic moral basis for making this decision through to questions about whether people should have the ability to emancipate themselves from this decision that people might be making or this new system that they might be creating. And you might think that that's a strange question to ask, because in most situations we kind of take it for granted that people have a choice whether or not they're part of a system. But if you think about it, there are plenty of situations where people don't have a choice. If somebody's on welfare benefits, for example, very often they're forced into systems that they really don't like. I've used this in the context of prisons, and you have a question there about, well, should prisoners be able to emancipate themselves from the system they're in? And the answer is probably no in many cases. This is the method he developed. Now, I found it useful to use in a particular way, because in a way those questions are abstract on their own. To make them even more practical, I've embedded them with these 3 rules that come from Ackoff's interactive planning. And I haven't covered Ackoff's work, but this is another systems methodologist. He talks about ideal planning, that you need to set aside all our current constraints that we're suffering under, and say, if you could do the ideal system, what would it look like? And you can bring together different stakeholders who, over a period of time, can develop a vision of what the ideal service or system should be. And as different stakeholders produce their visions and they test it out with other stakeholders, gradually a kind of consensual vision emerges. What Ackoff talks about is there being only 3 constraints on this kind of visioning to stop them being completely utopian. That it has to be technologically feasible. So you're not inventing some new technology. So you can have new technology, but it's got to be possible to develop it in the timeline of the project. You can't just invent technology for the sake of it. It's got to be viable, which means viable in all senses of the terms, ecologically sustainable, viable in terms of finances. So, you know, if your project is going to take the whole GDP of the country to implement, it probably isn't going to happen. And you've got to build in adaptability. So the idea with adaptability is that you don't create such a constraining bureaucracy, for example, that it's impossible to change to meet future requirements. So you have to be able to be open to future change. So what I realised is that you can use these 3 rules, and you can talk to people saying, we would like you to pretend that the current services don't exist, and your role is to design new ones with these 3 constraints, but answering the 12 questions that Ulrich poses in the ought mode, which means you're saying what things ought to be here. So I use this in terms of rethinking the criminal justice and mental health systems to prevent people with mental health problems ending up in prison with no access to appropriate treatment. It was a project that I did in the 1990s, and it was part of an evaluation of a service that was identifying people with mental health problems in custody and was trying to get them out. And when we found at the end of this evaluation that there were major holes in provision, because especially people who've committed serious crimes, there is no alternative secure custody that provides mental health services. So we said, if you were going to change the system so this problem didn't exist in the first place, what would it look like? And we got together a group of people who'd had mental health problems, who'd been in prison. We got them to do a design, and we got together the professionals, psychiatrists, social workers, community psychiatric nurses, all of these sorts of professionals, got them to do a design, and then brought the 2 together. And what was amazing about that was that, and this is I've done about 20 times in different situations like this, there was 95% agreement between the clients of the service and the professionals in the service. If they set aside their current constraints, they agree on most things. The difficulty, of course, then is to get from where you are now to the ideal state you want to be in. Akov talks about that in terms of means planning, and says if the gap is not major, then you can usually transition towards it with the people involved. If the gap is huge and it's really obviously an unbridgeable gap, then you're probably in a situation where you need political campaigning and political action, where you maybe need to get lawmakers involved, or you may need to get politicians to make decisions, and that just sends the thing in a completely different direction. So this is a way of really thinking about the boundaries that you're engaged in, because it asks all sorts of questions about things like who should be making decisions here. And in this context, for example, people made decisions like they wanted a user group, a group of people with mental health problems, to be continuously involved for consultation with the services. So the group that I'd got together for research purposes ended up continuing, and they continued to meet under their own steam afterwards. It asks questions about the boundaries of whole systems, because we started out evaluating a service that was very clearly defined about getting people with mental health problems out of prison. In the end, this design reversed the whole thing and said, well, people with mental health problems shouldn't be going into prison in the first place. There should be alternatives. And so how can you design that differently? This is all about the boundaries. So would you like to take 10 minutes to have a look at that sort of approach and how that would be useful in relation to your climate change work? One of the things that I didn't mention before when I was discussing this is what Werner Ulrich talks about 2 ways you can use this tool. That you can use it in a collaborative mode. So if you have stakeholders who are genuinely open to stakeholder engagement, you can collaboratively work together to get a shared understanding of what the system ought to be like, so you can begin to design some actions to move towards it. I find that even when you have got that shared understanding and openness on the part of policymakers, you often still need to give marginalised groups some safe space to have their own say. So with the people with mental health problems, for example, I worked with them separately before we ever brought their two plans together. And we actually didn't bring the two groups together because they said that they actually only really felt safe on their own. The other situation in which Werner Ulrich says you can use this is when you have an unjust social situation, when the policymakers are refusing to listen. And in those situations, he talks about using the 12 questions in a polemical mode. And what he means by that is you work with the people who are disadvantaged in this situation, and you can use those for consciousness raising. So they can use the questions to think through their own views on the situation and what they think ought to happen. And they use that then as the basis for their political campaigning and action. So he's very clear that systems practice has a political dimension and this is very often unavoidable when you're dealing with power relations. So you may have noticed as I was going through this that I've been putting up the different methodology labels like this, and you may have thought that's a very strange layout for this, and I'll explain why now. Do you remember I said at the beginning there was a paradigm war in the 1980s between the first and second wave, and one of the things that the third wave aimed to deal with is to get rid of that paradigm war. And the first solution to this paradigm war was this framework. So what Jackson and Keyes said is that different methodologies are useful for different kinds of contexts. This framework is what brought me into systems thinking and what made me decide to do my PhD with Bob Flood, who was one of the people who came in slightly later and did some work on this. Because it solved a problem for me. I had this problem of, I think quantitative and qualitative methods are both useful. And they said, yes, they are both useful. They are useful, and they're useful for different things, and we can actually say what those different things are. So I'll explain this diagram. Along the top, you have a dimension called complexity, and he categorizes things as simple and complex. I must say, when Jackson uses the term simple, I think what he really means is complicated, because there's very little that is so simple. If it was that simple, people could get on with it without a systems methodology. But complicated things need some kind of decision aid, and it means that they need structuring, so they're not immediately transparent. But they're not complex in the sense of having multiple perspectives and conflict and those sorts of things. And you've got complexity at this end. Down the side here, you've got the relationships between the people in the situation. Unitary means everybody's in agreement. Pluralist means that there's different perspectives, but they can still talk openly. And coercive means that there are different perspectives, but people can't talk openly or won't talk openly, and there's attempts at coercion. And when you think about how these approaches are aligned with these contexts, it makes a lot of sense. So system dynamics, for example, which is all about modelling the feedback processes, you have to have some agreement on what to model. Otherwise, what's going to happen is that people are going to say, well, you've modelled this problem from your perspective, it doesn't map onto our perspective, half the things in our perspective are missing from this model. So it makes sense to put it here. Also, if the environment is so complex that it's turning over continuously, the problem changes before you've had a chance to model it. So it makes sense to put it in that simple unitary box. Whereas viable system model is about designing organizations so they can deal with some of that turbulence, but you still have to have agreement that this organization is doing the right thing in the first place. So I tend to only use the viable system model when I've got that agreement. If I've got stakeholders, some saying this organization should be about a particular aspect of social justice, and other people are saying it should be about environmental sustainability, then you're not going to resolve that with a model for restructuring an organisation. This is strategic assumption surfacing testing starts from the notion that there are at least two competing strategies. But it's simple in the sense that you can specify that in advance. You know that there are two competing camps, you can bring them together. Soft systems methodology, on the other hand, just assumes that there's a mess at the beginning. Nobody knows really what they're going to do, and they have to learn their way forward in the face of that mess, which means it's better at dealing with complexity. And Jackson also talks about critical systems heuristics because you are able to use it in that polemical mode that I mentioned at the end there, where you can actually help empower stakeholder groups to take their own action with it. It's useful in coercive situations where you can build that capacity within stakeholder groups. He still says, though, it's a fairly simple situation because, you've got a situation where you can say, these are the stakeholders who've got power in the situation, these are the people who haven't. You can clearly see which side you're on and help those people. Whereas there are situations over here which are much more complex, messy, not so easy to work out, where coercion might be part of that. Now, I have to say that there have been numerous PhDs that have tried to fill that hole. And I don't think any of them have been all that successful. Jackson's answer to it was to put a methodology in there, which is basically a meta-methodology that helps you bring together all these things for use in there. And to me, that's an odd thing to do, to put everything else into that one box, in a sense. And so I'm still left with a slight puzzle here. Now, as I said, when I came into this really helped solve a problem for me, and this really gave me a starting point, both for my master's and for my PhD. So I did an MPhil before I did my PhD, and I did my MPhil on a very practical project, which was a European project, which was evaluating training services for people with disabilities to get people into IT jobs. And this was in the mid-1980s, when IT jobs were a new thing and PCs were just first coming out, and it was possible to really help design the systems so that they were much more accessible for people with disabilities. Yeah?
Sorry, could I just ask one question?
Yeah.
To fill this question mark, is it within the systems thinking? Like, you haven't sort of scanned other fields for other methods? Or your PhD students?
Some people have. Some people have. I don't want to go there because I'm going to raise some problems with this in a minute. But when I did my master's on this disability project, I used this framework to pick different methods for different things. So I used quantitative methods for some things and qualitative methods for others. And I quickly found out, so I think I was the very first person to use this framework in practice. Prior to me using it in practice, it had only been used for teaching. And I quickly found out it's problematic because it doesn't actually deal with as many things as you need to deal with. There are many more variables in there that you need to think about other than just the complexity of the situation and the relationships between the participants. So I want to give you 10 minutes to think through just the idea here. If you were to be in a situation where you had all these tools available and you could mix and match across them, would that be useful to you? Take 10 minutes to think through that. Okay, let's come back together again, please. So I've done this presentation with one group once who liked this framework so much that when I started talking about critiques of it, they really resisted it. And they said, well, we like box frameworks. It kind of does make sense, but there are problems with it, and the people who've used it in practice have brought problems. So the problems I want to discuss come from 5 different researchers. They come from, yeah.
Sorry, before we get into this,
Yeah.
One thing that we discussed in our group that we're kind of curious about, maybe you will get to it.
Yeah.
But like the evaluate, like how do you evaluate, and where in these models are you evaluating the effect of it, or if it was successful, and whose vision of success is it, and which stakeholders' opinion of this was a good thing or this worked out really well? Like, how is there an evaluative process built within these methods?
Okay, that's another presentation that I could give you. Let me answer that quickly, but I have got a 45-minute presentation on that one. I had a project in 1999 where myself and this woman, Julie Skinner, were evaluating a project in the northeast of England where it was an action research project where a very well-known action researcher who wanted anonymity so we could do an evaluation, you know, warts and all evaluation of what he did. And he was working on child safety in the community, so he was going around all sorts of projects to do with child safety and helping raise awareness of when children are vulnerable and what their policies need to be around this sort of thing. And so he'd done a huge amount of work in this community, and we were asked to evaluate this. And what we said to him is, give us 5 examples of where you really thought you'd made a huge difference, and 5 examples where you thought you hadn't had any influence at all. So your 5 most extreme cases. And we followed up with all the stakeholders of all of those. And we discovered that there was no relationship whatsoever between what he thought was successful and what the stakeholders thought was successful. I mean, it was 0 relationship. And this is a really well self-reflective person who, you know, who wanted an evaluation. He was shocked at the results of it. So it was like things like this. So he had run workshops with people, and when we asked them whether there was change, they said yes, there was change, but it wasn't that workshop that created the change, it was this other conversation they'd had with somebody else, let's say, that was more influential. On the other hand, there was one project where he was actually physically thrown out, where they said he'd had a huge impact on them. So it was a project for gay teenagers, and so he went in talking about what if paedophiles are using this project to pick up young kids. And they were furious. They're saying, you're associating paedophilia with being gay, and they're completely separate topics. Get out, we don't want anything to do with you. And so they physically ejected him from the building. And later, obviously because this was on their mind, because he'd been there, they noticed a guy hanging around outside. And when they questioned what he was doing there, he was picking up boys as they were leaving the building. So they realised that they did have a problem, and that they'd been, and although they didn't invite the guy back, it completely changed their approach. So when I did that project, that fundamentally changed my attitude, and I build evaluation into everything I'm doing now. The evaluation comes from 2 places. There's, on the one hand, there's the things that I would like all participative methods to think about. There's a questionnaire I've got that I give to all the participants that is based on what all the various different participative approaches say that they do. So we can assess whether people think that those things have been achieved. So I do that. And on the other hand, I look at the stakeholder objectives that the stakeholders themselves want out of this, which could be different for different stakeholders, and we measure those things as well. And then we bring key stakeholders together in a workshop and work through what the data we've collected means in terms of what you can attribute to the success of the project, what you have to attribute to other things, what are the contextual factors that have to be taken into account. So essentially we're looking at 4 things in this framework. We're looking at the methods themselves and the assumptions that go into it, the assumptions that the methods are making, and the assumptions that the practitioners are making. We're looking at the purposes that both the stakeholders and the practitioners bring in. We're looking at the context, and that's context both for the practitioners and the identity issues of the researchers, because sometimes there are real clashes of identity, not just purpose. And then we're looking at outcomes, both intended and unintended. And that's if we had time for another talk, I could give you I could go through that framework in detail.
The unintended outcomes can be very interesting
Yeah.
and give you insight in parts of the system that
Absolutely.
have not drawn connections.
Absolutely. So this is the thing with any systems work. You're trying to deal with the inevitable lack of comprehensiveness, which means you should be humble enough to think that we've been more systemic than we would have been if we'd taken a traditional approach, but we'll never be 100% godlike in our comprehensiveness, which means that those things can happen. Things you didn't expect can happen, and you've got to be aware of it. Okay, so that was a good distraction. So let me go into some of the criticisms of this framework. So the first one is the one I actually said. 2 dimensions for choosing which methodology to use in practice is not sufficient. It's more complex than that. And just to point out an area of complexity that you might not have thought of, what about if you've got a team of practitioners and that team has particular limitations on their skill set? There are certain, I have this all the time working in teams. You get people who are resistant to using particular approaches, not because they're not worth using in that situation, but simply because they don't feel confident in using them. So there's a whole skills of the practitioner element here that is not taken account of, for example, in that framework. One of the things that came out of my work with this is that we should be mixing methods, not methodologies. Because there's 2 reasons. One's a theoretical reason, because we end up with a mess of philosophical contradictions. We start saying, well, systems are real world and systems are subjective, and it all gets muddled up. But I think I prefer talking about methods because you can really be flexible and responsive there. So you can, for example, say, we're going to do that critical systems heuristics and we're going to design what the service ought to be from the perspectives of the stakeholders. And now we can just take the conceptual modelling part of SSM to design the activity plans for that. And then you can go on to something else. So you can pick and mix bits of the different approaches rather than seeing them as wholes. Putting them in boxes like that makes people think of them as wholes, and you can just have to pick those holes. So as I was saying there, putting methodologies in boxes suggests just choice between them, and actually you need to mix methods much more creatively than that. Wendy Gregory made the point as well that putting methodologies in boxes freezes interpretations of them. So if you actually believe this framework, then system dynamics is only of use if you have agreement with stakeholders and it's a fairly simple situation, and you're doing some kind of quantitative modelling. Well, actually, system dynamicists have evolved their practice, so now they can do it much more quickly on the fly in a qualitative way. They've rethought the methodology, so it's no longer just about prediction, it's about learning. And so as the second wave came in, they changed their approach. As the third wave came in, they changed their approach again. If you actually use a framework like that, it freezes those methodologies and people stop learning about them. They want to keep those same interpretations. And the other thing that came from one of my PhD students, Lewis Pinson, and when he told me this, I just thought, this is such an obvious point. And I wish I'd thought of it myself, but he said the diagnosis of the problem context that you get from participants is part of the problem. Why would you want to just go for whatever some